So yeah, hi everyone. My name is Kathy Lee. I'm a registered nurse at St. Paul's Hospital. It's an acute care hospital in Vancouver, for those of you who don't know. Today, I'll be talking about an oral care project on the ACE unit. So ACE stands for Acute Care for Elders. So it's still an acute medicine unit. It's also called acute care for older adults, if you're specific about wording. So this oral care project started with the Providence Healthcare Research Challenge in 2021. Our goal, as stated, is to improve oral care, to decrease the risk for adverse healthcare events, and to improve patient health outcomes, satisfaction, and quality of life. So my team is quite diverse. I have some pictures of some of my teammates. We have Andrea, the SLP, Holly, my manager, she's also a dietitian. In the middle, I have Melanie, she's our patient partner. And I also have Shun Hao and Karen. They are from UBC Geriatric Dentistry. And I also have Julie from professional practice at Providence Healthcare. And I don't have pictures listed for them, but I also have Samir, our statistician. And we also have the support of David and Michelle, our clinical nurse leaders on the unit, and Sarah, our occupational therapist. So just some background about oral care and geriatric patients and how this all relates to health, in case you didn't know. Making sure older adult patients receive oral care, like brushing your teeth, cleaning your dentures, using mouthwash. This is usually the responsibility of our nurses and our care aides. And oral care in our units can be missed due to lack of time. It's a task easily forgotten. Sometimes the patients refuse, or the staff may lack knowledge, skills, or protocols. This is especially concerning for our geriatric patients, so patients age 65 years and older, because older adults, especially those with dementia from long-term care, or those unable to maintain their own oral health, are vulnerable and may depend on caregivers to help with oral care. And without this help, they are at risk for poor oral health status, including dental plaque, harboring potential pulmonary pathogens. And it's the aspiration of bacteria from dental plaque that may facilitate the progression of pneumonia and other systemic diseases. In our population, poor oral health status is also a risk factor for adverse health outcomes, such as physical frailty, disability, and mortality. And many studies have shown that thorough oral care can reduce the colonization of pathogenic bacteria in the oral cavity and subsequently reduce the risk of pneumonia. Patients with hospital-acquired pneumonia can have an increased average hospital length of stay by as much as 28 days, and an increased mortality rate of 18%. This shows the impact oral care can have on health outcomes, healthcare costs, and most importantly, the quality of life of patients. So lack of oral care negatively impacts patients' quality of life, as poor oral health results in mouth pain, difficulty chewing, reduced intake, and less enjoyment of food. So based on all the good things about oral care and the bad things that can happen without it, the ACE unit has begun implementation of an oral care program. So this includes staff education, printing resources, stocking appropriate oral care supplies, individualizing oral care plans, and training up champions. And when we did our chart audit in May of 2021, before we started the oral care program, we found that less than 20% of oral care was being documented. This could mean that staff weren't doing the oral care and they weren't charting it, or it could also mean that they were doing oral care, but still not charting it. So we don't know for sure because it's the association there, might not be causation. But one of our goals of our program was definitely to improve documentation of oral care. And in our partnership with UBC Geriatric Dentistry, we are learning about the best practices when it comes to oral care with older adults. And this population may have different needs. So in May, we had in-services led by Andrea, our SLP. And from these in-services, we also had staff surveys, which we found that staff weren't reporting oral care problems to nurses or the doctors as often as they should. And they also lacked knowledge of use of different oral care supplies and oral care situations like denture care or caring for patients with decreased level of consciousness. And then in December, we had 15 interviews with patients and families. And the feedback we got was they wanted a routine time for oral care. They wanted adequate supplies for oral care, and they wanted staff to have adequate knowledge when it came to oral care. And then in January, we finally got all the supplies we needed. In February, we created documents to help guide oral care on the units. In March, we implemented personalized oral care plans for each patient. And now today's April 1st, we are starting oral care champion training for the rest of the month, training up champions on the unit. And in May, we will be doing a chart audit throughout this whole time to see if there's been any changes. And in June, we will be doing interviews with patients and families again to see if their experiences have changed. So this is a picture of the before and after. So before, as you can see, our oral care supplies were messed up. They were here, there, in between socks and shampoo caps. And afterwards, we put them all together and they're all placed in 2 rows, very easy to find. We also replaced the foam suction swabs with toothbrush suction swabs because foam can be a choking hazard as it can be bitten off by our patients. And it also doesn't adequately brush off the bacteria that a toothbrush would. We also added mouth props, which can help keep mouths open for patients who bite or have decreased level of consciousness. We also added floss picks and denture cleansing tablets as requested by patients and staff. And we also added larger size toothpaste because for the smaller size toothpaste, our patients sometimes had difficulty opening them. And this is a picture of just the other clean utility room we had. As you can see, it's much more organized. And this is a picture of the oral care supplies picture guide that we have provided for staff. So when they go in to pick their oral care supplies, they have this legend, they have this map, they know exactly what each supply is for and how to use it. And we also created an oral care decision-making tool for staff. So for different oral care situations, they know what the follow-up is and when they should be consulting the physician. So this picture has the different oral care plans individualized for patients. So currently we've implemented this. When patients are admitted, the nurse will figure out if they have teeth or no teeth or dentures, and they will choose the correct oral care card. They'll circle their level of independence with oral care, and they'll post it at the patient bedside so that all staff who come in will know what supplies they need and how to care for this patient when it comes to their oral care. So starting today, we have our first oral care champion training workshop. So for this, it's 4 hours. They'll have hands-on training. They'll learn directly from our UBC geriatric dentistry educator, and they'll hopefully have the ability to mentor other staff on the unit when it comes to oral care. For this, they will also have ongoing support from a dental hygienist through a WhatsApp group so that they can ask questions in the future if they still have questions about oral care. So this is a picture from Cerner. It's our documentation at the hospital. As you can see, there are 3 places to chart oral care, which is like repetitive charting. So staff may not chart in all areas, but we are teaching staff that these are the 3 areas that you should be charting oral care, and we will be doing our chart audit on these 3 areas. And to summarize, so our timeline of where we've been so far, and at the top, it's oral care for geriatric patients. Without it, there can be health concerns and the quality of life is also affected. On the bottom, I have 5 different points that attribute to our sustainability of the project. So for the first one, leadership support. I was very lucky that we have the support of our manager and the support of our CNLs. Without the support, I don't think our project could have taken off and be sustainable. The adequate supplies, making sure we have adequate supplies. So working with our unit clerks and our stores as well, just making sure we have the correct oral care supplies, and creating document and resources. So right now we have the oral care plans, we have the decision-making tool, and we have the picture guide. My hope and our goal by the end of all this is to create an oral care policy in acute care, because right now we have one for residential care at Providence Healthcare, but not for acute care. And also having oral care champions on the unit and having ongoing support from a dental hygienist as well for sustainability. So this is the end of my presentation. I hope our story can give you ideas for your own workplaces, whether it's related to oral care, research, quality improvement, or program sustainability.